Welcome to Grassroots from the Nursing Now Challenge, a programme of the Burdett Trust for Nursing. Grassroots aims to amplify the voices of nurses and midwives driving change from the ground up. We're shining a light on how nurses and midwives are shaping the future of healthcare, often in the most challenging of circumstances. In this first episode of the Grassroots podcast, we speak with two winners of the Nursing Now Challenge Global Solutions Initiative, Mitchel Awiti, a nursing student from Kenya, and Benedicta Oganyinka, a registered nurse from Nigeria, about their work to raise awareness of HPV and cervical cancer. In conversation with Mitchel and Benedicta are Andres de Juan Ortega, registered nurse, PhD student and Challengers Committee Regional Hub Lead for Europe, and Menashe Nyika, a nurse, human rights activist and member of the Challengers Committee Africa Regional Hub.
Welcome everyone to a brand new episode of the Grassroots podcast, brought to you by the Nursing Now Challenge. My name is Menashe Nyika. I am a former Nursing Now Advisory Board young early career nurse, and I'm a nurse from Zimbabwe. So today, the episode is really special. We're celebrating innovation, leadership, and the power of young nurses and midwives to drive change. We're joined by incredible winners of the Nursing Now Challenge Global Solutions Initiative, or called NNCGSI, which is focused on tackling HPV and cervical cancer in partnership with the Sabin Vaccine Institute's Global HPV Consortium. So really exciting to be here and to hear from these amazing nurses that we have today, and particularly on this topic. So I actually work in cancer care at the moment, and it's really been interesting to see the advances, particularly in terms of the HPV vaccine, and the impact it has had in reducing global cancer burden. So really looking forward to being able to go much deeper into this conversation with these nurses. And back to you, Andres.
Yeah, first of all, and before jumping to the general questions about the topic, I would like to ask you if you could introduce yourself and explain what is your background and main ideas of what you have done so far until now. And then we will jump in deeper into the topic that we will be discussing today. So I don't know, Michelle, if you want to start, let's talk about your background and introduce yourself.
Thank you, Andres. I'm so glad to be here with all of you. My name is Mitchel Akini. I am from Nakuru, Kenya originally, but I am a nursing student at Chuka University, where I am currently based. I'm very enthusiastic about reproductive health, community health, policy advocacy, and also leadership. And I am so glad to be amongst you, and I can't wait for us to have this conversation.
Hello, everyone. Thank you very much for having me here. I am Benedicta Oganyinka from Ogun State, Nigeria. I'm a recent graduate from the University of Ibadan in Nigeria, and I'm currently an early career nurse as a nurse intern in Nigeria. I'm passionate about being impactful, especially in my areas of interest, that is research, female reproductive health, health innovation, and also mentorship programs.
Benedicta, could you tell us a bit more about how did you first heard about the Global Solutions Initiative, about this topic, and why did you decide to participate?
The Nursing Now Challenge Global Solution Initiative through the Nursing Now Challenge Network, of which I'm a member. And when I saw the HPV vaccination team, it immediately caught my attention as it's aligned perfectly with my research interest and previous work on HPV vaccine uptake among young women.
Mitchel, please. Could you answer the same question? How did you hear about the topic and the initiative, and why did you decide to participate in this initiative?
Thank you. I hadn't heard of Nursing Now until I heard it from a friend of mine called Zipporah Iregi. She won the previous challenge.
You know her, yeah.
Yeah, she won the previous challenge. And so she as I've been looking up to her. She's been like my mentor, and she really encouraged me to participate. And I was also very excited because I'm very passionate in reproductive health and primary prevention measures. And that is why I was so excited to get into the challenge and see what I can contribute in the challenge.
And following to that question, and what was your understanding about about HPV and cervical cancer? It is something that you already knew a lot during your period at the university or in the nursing school, or it was something new that you would like to contribute on, or why did you participate in this topic? It was something that you knew about it?
Yeah, of course, actually, because I had a personal experience with one of my very close family members who went for a routine screening and apparently it was detected. So that was a very big change for her because she got early treatment and she was able to recover. And when I saw this initiative, that is the only experience I'd ever had. And coming from the place where I am right now, it's a very remote area. Topics around vaccines, especially those that are given to young girls at a young age, are very, very controversial. And that's why I was very intrigued. I wanted it to be a topic that we can dive into. I didn't have a lot of knowledge on it, but having entered into the challenge and the initiative, it made me have a wider view of HPV and cervical cancer.
Okay, I love it because sometimes when you have this personal experience when you enter to a new topic, it's like you have a motivation behind it, and I think it really helps through the whole process. So that was very good, actually. Munashe will talk and we'll ask you now about the innovation process, how everything went during the whole process, how did you develop everything. So please, Munashe, if you would like to jump in.
Thank you so much, Andres. And I totally agree there where you say, that personal connection, when coming up with these initiatives, it motivates you and it encourages you to want to get the solution in the first place. So let's talk a bit more about that. And I will just pass between the both of you, Benedicta and Mitchell, in terms of the innovation itself. So could you briefly describe your project idea and the problem it aimed to solve? Let's start with Benedicta.
All right, thank you. My project targets three major gaps in HPV vaccination, that is awareness, uptake, and data management and tracking. The school provides a safe and trusted environment for learning, and through school authorities, teachers, and vaccination teams, students can learn about the importance of HPV vaccine. They can unlearn misconceptions surrounding vaccination and also share this information with parents, friends, and out-of-school children. Integrating vaccination within the school also helps to increase uptake. Like instead of waiting for the community to come to you, why not meet them where they are? As the school also hosts the key target population for HPV vaccination, that is girls aged 9 to 14. And finally, through accurate data surveillance and tracking, records are kept on children reached, vaccine coverage can be mapped out, and workloads can be easily distributed among the vaccination teams.
Perfect. Thank you so much, Benedicta. And I totally agree where you say, meet people where they are. And, that's one of the best strategies that we have in terms of driving some of these solutions in actually meeting people where they are. And I'm sure, particularly through running this project, you must have encountered quite a number of challenges. Would you want to give us any idea in terms of what challenges you faced while developing your solution and how you overcame some of these challenges?
Okay, thank you. One challenge was to address reaching out of school adolescents and ensuring equitable access to the vaccine. I also considered how to sustain calls and partnerships for long-term implementation, but I believe that integrating community sensitization, collaboration with local healthcare authorities, and also digital innovation for better tracking and accountability, these challenges can be solved.
Mitchel, I'll come over to you. And would you want to talk about your project idea and the problem you aimed to solve?
Thank you. So my solution was majorly based on the community where I live, because it's very different from the community that I originally come from. And having done my clinicals in this area, I noticed there's a huge gap when it comes to communication, and it majorly tackles misinformation, myths, and also access to the vaccine. So my solution was using native language, illustrations, and media to be able to convey these messages concerning HPV and cervical cancer screening. Because I believe that language is the greatest gift that we have been given. Being able to communication cannot be able to be very relevant if there is no understanding. So I believe that most people in these rural settings, in my country, we have so many tribes. We have 47 tribes, and each tribe have their own language. And these are still people who are still affected. These are women who are still affected by cervical cancer. These are young girls who need the vaccine. And so that diversity, I realized there's a gap in communication, because we have healthcare workers who come and maybe talk to them and give them some education, but they don't understand. They feel like they are not being understood. So by using the native language, using illustration, using storytelling, which is using stories that they can relate to, having cancer survivors come and tell their stories from their communities. We are not taking people from other communities to come and share with them. No, we want to make them feel included and feel seen and feel heard, so that their access and uptake of these services can be able to skyrocket. So that was my solution. And I think I can talk about the challenges maybe I had encountered while coming up with this solution. One was the human resource that is going to be needed in actualizing this project is going to be massive, because if you are in my concept note, I had come up with this idea of having skits, having these theatrics, maybe drama of acting out how cervical cancer is affecting the community, how HPV is important. And this needs a massive human resource and people who come from that specific community. We have to also collaborate with the healthcare workers from the specific community so that they are able to resonate with them. So the human resource is going to be really big, and that is one of the challenges. And also another thing is having to reach these people in the most remote parts of the country is going to be a bit difficult. Having factored in the infrastructure is not as pleasant, the weather conditions, and even the security of some of these areas. So it's going to be a bit costly to maintain having to travel from different areas of those rural parts. But I believe that when we actually take into consideration that language is very important, and even if we are giving out this information and we are not keen on, are these people getting it? Are these people feeling seen and heard? Are they understanding? Are they resonating? It's more of also an emotional thing for them, because if they are able to connect it and be able to feel like, oh, these people actually are understanding us, the uptake and even the misinformation, we can be able to dismantle them, and we can be able to give the correct information needed for these people to take the services.
That's really wonderful, Mitchel. And talking about communication, I think communication is one of the key points. So it's really great to hear you talk about your project. And it really speaks about that aspect of accessibility. So making it accessible to people in a way that they would understand, putting languages, so using their native languages, so that they are able to understand the topic in a way that makes sense for them. So that's really amazing. Well done to the both of you for putting together such amazing projects. And just to ask a bit further, Michelle, in terms of the mentorship and collaboration during the program. How did it help shape or refine your idea?
Okay, so when it comes to the mentorship and the collaboration that I had to shape this, I realized actually that there are so many people who are going to come into play. It's going to need so many people from different fields, a multidisciplinary collaboration, because you'll have healthcare workers, we'll have people who are studying film and media to create these kits. We'll have to arrange with the local authorities to be able to reach these people, and also schools, and also these in these communities they have guilds, so women guilds where they are able to come together weekly and discuss on things that are affecting them. So it's going to be a multidisciplinary collaboration that is going to be needed to actualize the project, where we can have so many people come in and give their contributions and be able to make sure that we are doing it for the sake of these people so that they don't feel left out.
I totally agree. And I think you've actually just segued us in a great way into the next section when we're talking about that impact of HPV awareness, and how there are so many stakeholders, there's so many people we need to take into account in really looking at this impact of HPV awareness. Andres, I'll hand it over to you.
Yeah, I would like to explore a bit more about the topic that Manisha just mentioned. I would like to ask you, Benedicta. Well, as you may know, that one of the biggest barriers in so many countries are it's probably the access. But if you would have to just pick up one next step that you would like to do to continue the project, if imagine that you have like limited funding or limited help and you cannot do everything, what do you think should be the most important step to continue or to try to have the best success for your project?
If I could develop my projects further, my next step would be to pilot it in selected schools, at least across 2 Nigerian states. Although my dream goal is to scale it nationally, integrating digital HPV vaccination surveillance into all school health programs, and collaborating with the National Primary Healthcare Development Agency in Nigeria and partners like Sabin to achieve sustainable coverage and equitable vaccine access. But I would start with a pilot program to test the limits of the resources I could get.
Mitchell, what do you think should be your next step in your project?
So for my next step in this project, I was thinking of collaborating with the county governments of this, because our country, we have county governments apart from the national government. So the county governments are mostly in charge of health for each county, and a county has so many diverse communities and who speak different languages. So collaborating with the county government so that they can be able to release the human resource, the financial resource needed to be able to reach out to people in these remote areas. So that would probably be my first step. Maybe we can have campaigns in these remote areas so that we just don't do them in major towns or major hospitals. We move to the people, we get to where the people are, because some of them are not able to access to come to the hospitals. It's too far for them. They feel like they don't have the resources. So even having mobile clinics and taking it to them and being able to see how it's going to pan out.
Okay, I have heard that you have mentioned several barriers. What do you think is the main barrier in your community or where you work? What is the biggest barrier that you have found regarding HPV or cervical cancer? Is it access? Is it misinformation? What is it?
Okay, in my community or where I come from, the biggest hindrance or the biggest challenge is definitely myths and misinformation. And some have no knowledge at all. If you ask them, have you ever heard of HPV vaccine? They're like, what is that? We've never heard of that. So that is a really big issue. But also misinformation. Those who have heard of it have heard things about it that are not good. coming from a place where people are deeply rooted in tradition and in culture, they have a certain notion of things in healthcare. For example, vaccines, even if it's not for HPV, some don't even take their children to get the vaccines that they need to get, like the polio vaccines, the BCG, all of that. They don't take them because they have this notion that especially when it comes to HPV, for example, if your daughter is given the vaccine, they might end up not having kids in future. And these are communities that value kids and they value family. And so when they get that misinformation, it becomes so hard to actually try and talk to them to come and take these services. Some of them, they know about cervical cancer screening, but they think that maybe these are very expensive services that you cannot afford. Maybe these are services that are going to mess up with maybe our bodies or something like that. So I feel like misinformation is the biggest challenge that currently facing my community.
And how do you think, and this is a question for the both of you, please go ahead, Mitchel, and then Benedicta. How do you think nurses and midwives when they are in the early career phase, or even though when they are still studying, how do you think these nurses or these students that might be listening to this podcast later on could prevent that, or could try to face that, could try to fight against that? Can they do something when they are studying, when they are students, or can they do something when they are in this early career phase? How would you encourage them? And please go ahead, you, Mitchel, and then Benedicta.
I know nurses are the epicenter of healthcare, and nurses are everywhere, literally everywhere, and we form the majority of healthcare workers. That's and right. Just by the way we talk outside the clinical setting, people listen because people know these people work in the hospitals and they know a lot about healthcare. So I feel the role of nurses and midwives and even early career nurses and students is we should be very keen on the information we give out when we are interacting with these people. And we also should make sure that when we are interacting with these people, we try as much as possible to dismantle these myths, even if it's in just a casual conversation. These conversations are the ones that these people trust. They take it because they know you're not trying to sell anything to them. These are just conversations. So they take it as genuine and they go and ponder on it.
Could you add something more, Benedicta? What's your experience about it, or what would you encourage?
Drawing from what Mitchel has said, nurses are often the first point of contact in healthcare, and they can serve as a strong advocate for prevention. I believe young nurses and students can contribute by participating in awareness campaigns, volunteering in vaccination drives, and also engaging in health innovation challenges. Our voices as young nurses are powerful in influencing peers and communities, and by combining education with creativity, we can bridge the knowledge gap and also strengthen preventive healthcare.
I must say to you both that it's really evident in terms of your passion, like it really comes out as you speak. And really well done for being pillars within your communities in driving some of these changes. In reflecting on the NNC GSI and this experience that you've had, let's talk a bit about that. And what was your biggest takeaway from being part of this experience? You can talk about it from a personal aspect or from a professional aspect.
As someone passionate about healthcare innovation, my biggest takeaway from the Global Solution Initiative, the challenge, was that innovation in healthcare starts from identifying everyday challenges and turning them into an opportunity for change. The program also strengthened my confidence as a young nurse because I was a student nurse when I ventured into the program, and innovator, and also equipped me with the tools to design, to implement, and also advocate for a practical public health solution.
So my biggest takeaway from this Nursing Now challenge Global Solutions Initiative is mostly that just because we are giving out information, it does not mean that it is being taken and absorbed the way we think it is. Because as I was doing more research on the solutions and my solution specifically, I saw that there's a big gap, and there is a big gap, especially in communication and having to dismantle these myths, and a lot of work needs to be done. So my biggest takeaway, I can say, is that we need to make sure that there's no gap. We need to bridge the gap between the people in these rural places and the healthcare workers, so that the information being passed and also the services being given are the ones that need to be given.
When you officially got the confirmation that you were a winner of this challenge, what was that feeling like? And would you like to describe the moment? Let's start with Michelle.
Wow, I still remember that day when I got the email, and funny enough, it was on my birthday. So
Oh, wow.
Yeah.
Okay.
I remember it was just in the evening, and I just received an email, and when I went to check, I'm seeing I was shocked, elated, excited, and honored at the same time. And I saw it like, oh, this is the best birthday ever. And I remember telling my friends, this has to be the best birthday ever, because I've just received an email that I didn't expect. And I was also excited to share this solution with the other partners from the consortium and also other students. So yeah, it was just joyful for me.
Benedicta, how did you feel when you received that email and confirmation of being a winner?
Okay, for me, it was a fulfilling moment because it reaffirmed that meaningful ideas, no matter how small they are, they can create global impact. And it was a humble reminder that passion, research, and persistence truly pays off.
Munashe, to jump in, just to ask, we've heard that you presented and you collaborated with Global HPV Consortium partners meeting, I think. What was your experience during that conference, that meeting, that journey?
I saw the presentation as an opportunity to build collaboration and also explore how my initiative can contribute to global cervical cancer prevention goals.
Yeah, for me, it was a very good experience, especially being still a student nurse. It was very honorable for me to be able to present my idea, which I thought was small at first, to these partners who are really interested to making a change when it comes to the HPV and cervical cancer. And it was also a big opportunity to network and be able to share my innovation with people from different places in the world. So it was a good experience.
To bring everything into a final message, like to share with the audience. Following the lead of what you were saying, Mitchel and Benedicta, I think, well, we have seen that this really impacted you and really helped you to have a different vision, or a bigger vision, a bigger picture of what happens in the healthcare world, what happens in your environment, what can you do, like you have gone beyond the limits. At least it's like this is my perspective or my feeling when I'm listening to you. Like you have experienced something and you're now sharing it with us. But you have gone beyond something that some people could never really imagine. So now you might think like a different mindset. Like you might dream and you might know that dream could be true. So following this idea, how this experience have shaped your goals in short term, long term, and how do you imagine your nursing career?
As I mentioned earlier, this experience has, reaffirmed and also shaped my vision to continue developing as a researcher, and also as an advocate for female reproductive health. I aim to work with organizations like the WHO or the United Nations to implement innovative health solutions that addresses gender-specific health challenges, particularly in low resources settings.
This challenge or the solution that I came up with, it has really been able to confirm to me that the community is my heart and that reproductive health is where I belong, because still being a young nurse, I had this grapple of where do I belong, where do I want to land on, and having to work and coming up with this solution and looking at this project, I have been able to know that this is what I was meant to do. I was meant to be in the community. I was meant to bring healthcare closer to the people, and I was meant to be in reproductive health.
If you have to share a message, one message with global health leaders, what could be your comment to them to support this kind of initiative? And at the same time, what could be your advice to young people?
Okay, for global health leaders, I would just give them one message. The future is now. Young people have these great ideas. I was listening to Benedicta's idea and going through her work last time we had the meeting, and it was brilliant. And I was like, there are so many young minds who have these great ideas and great solutions, but they don't have a platform. And we're so lucky to have Nursing Now Challenge, because it gives us a platform to be able to share our ideas, our innovations. So global health leaders should really look into what the young people are coming up with. They might be young, but they have these fresh new ideas that can be really impactful and really resourceful to the community. And also to these young nurses, these early career nurses, your idea is not too small. As much as you think this is too small, it doesn't seem like it might have an impact. No, it has an impact, and it can make a huge impact. And the butterfly effect will just be so big. So no matter how small you think it is, just have a platform like Nursing Now Challenge, which is good for mentorship for young career nurses and students. Take this opportunity and run with it.
Benedicta, what could you say to them?
Okay, my message to global health leaders would be that transformation starts from the grassroots up. They should invest more in young nurses, as Mitchel has rightly put, and to provide platforms for innovation, mentorship, and also leadership development, because empowering young nurses will drive sustainable healthcare transformation. And my advice to early career nurses is to stay curious, because for me, my curiosity brought me here. My encounter with a patient on the ward led me to working with a research around cervical cancer, and also developing this initiative, and to never underestimate the power of small ideas, because every big solution starts with a simple observation.
Muneshe, would you like to share final words with us and with the audience?
Thank you so much, Andres, and really powerful statements at the end there. I loved how you both highlighted to young upcoming nurses, to stay curious, that no idea is too small. I think those are powerful statements to the people that will be watching this podcast and listening to you both. And also the aspect of global leaders, that global leaders need to listen to young nurses and early career nurses, and that advocacy piece at the end. I think that was a strong call to action. So really, what an inspiring conversation. It's been fantastic talking to you both, Benedicta and Mitchel. And thank you so much for sharing your journeys, your ideas, and your passion for improving access to HPV prevention and care. It is really clear that young nurses and midwives are not just the future of healthcare, but you're leading innovation right now. So to everyone listening, if you'd like to learn more about the Nursing Now Challenge Global Solutions Initiative or get involved in future opportunities, visit nursingnow.org/challenge and be a part of this. Thank you again, Andres, for
Thank you. Thank you
joining as well, and for us co-chairing this session today. It's been lovely co-hosting with you. And to all our listeners around the world, thank you for joining in and listening to us today. Until next time, Keep leading from the grassroots.
Grassroots is a production of the Nursing Now Challenge, a program of the Burdett Trust for Nursing. All views and opinions expressed in this podcast are personal to the hosts and guests and are not necessarily the views of the Nursing Now Challenge or the Burdett Trust for Nursing. For more information about the Nursing Now Challenge and this podcast, including upcoming episodes and featured speakers, head over to nursingnow.org.